Have you ever thought of bartering with your doctor, using credit payment plans to your advantage, or negotiating for a reduction in fees? Few people know that these options are readily available to them as patients and consumers. Dr. Carm is here to share creative ways to save money or at least better manage your health care costs. Dr. Carm, great to have you here.
Great to be here.
And this is not something I think that a lot of us really are aware of, that these costs are variable and you can make the system work to your advantage sometimes.
Yes, I mean, my mother idolized physicians, so she would never have thought of asking for a discount. But that was a long time ago. And so today, here with the ever-escalating costs of health care, we really have to think about these things.
How can you compare prices? I mean, how do you do that?
There's so much available now as employers have shifted more of the cost over to the employees of their health care. We also have tools available. So they're usually referred to as transparency tools. And the state that you live in actually has transparency tools. So you can go out, Google it, and you can come up with a tool that will actually allow you to take the procedure you're looking at and the zip code you live in and start looking at the differences between the cost in different facilities or between different physicians. There's a huge variation. It could be 20, 30, 50%. Many people don't know that if they go and get an MRI through an emergency room, they could pay 2, 3, 4 times as much as if they get it in an outpatient MRI facility.
Really?
Yes.
Okay. Well, but then again, do you always want to go with the cheapest?
Well, you know what? It's interesting because most of the transparency tools actually have a quality indicator on there.
Good.
So you can see if it's 2, 3, 4 star. And especially if you look at a transparency tool through your insurer, they will always try to put in a quality aspect.
Good. Can you really barter with your doctor?
Well, it's interesting because the days of physicians getting paid with chickens or oranges are probably over. You know, I'd probably take a chicken. I like chicken, yeah. However, I think it's really important. If you are willing to pay in cash, if you don't have insurance and you're willing to pay in cash, many studies have shown that you can call up and you can ask right off the bat for a 20% discount. Because what's going to happen is that doctor will get the money immediately rather than having to wait for you to pay on payment plans or going through the insurance.
Okay, but if you do have insurance, it doesn't pay to pay in advance with cash.
Because it's really important if you have insurance to stay within your network and to go with the insurance, because the insurers will, on your behalf, negotiate with the physicians and get the best deal.
Oh, okay. First, you also say ask why you have to go and why you have to pay. What do you mean?
Well, I had this happen over, you know, the December time span. I went for my colonoscopy. Turned 50, you know, you have all these wonderful things to do. So I went for the colonoscopy. I knew it was a screening colonoscopy. I had no symptoms. And screening procedures now are zero. They are free through the Accountable Care Act.
Good.
So I was not expecting a bill.
Or the Affordable Care Act.
Affordable Care Act. But there, lo and behold, I get a bill for $500, $600. Yes. And so I, you know, being in the business, I'm like, what's going on here? So I call up and find out that they coded the wrong code and it went in. Always ask why you're paying what you're paying for. So it's very important to do that.
Interesting. Yes.
And the other thing, too, is make sure that you have to go into the physician. Let's say you have high blood pressure, and the doc says, come in every other day and get your blood pressure checked. But he or she doesn't know. You're getting a copay charged every time.
Right.
Get someone to take your blood pressure at home, monitor it, and call it in.
Will they accept that?
Oh, absolutely. If it's a bona fide person who's taking it, and you know, you even have those ones you can get.
I've got it at home.
Yes.
I do.
I mean, you could read the number.
I can.
Yes.
I can. So basically, just stay as healthy as possible as well, right?
Stay as healthy as possible, because studies have shown that, you know, you are going to pay more if you do not get your exercise, you don't eat well, you're not getting your sleep. Like I always tell my mother-in-law, if you eat the donut, you're going to fall in the donut hole, which means you're going to pay more for your pharmaceuticals. So stay away from the donut, stay away from the donut hole, and stay healthy.
Dr. Carm, great advice. Thank you for saving us all some money. We'll be right back.